So fungus can be classified in various ways. They say that three ways of classification are there. One is morphological classification, according to which fungi can be classified as yeast, yeast-like, mold and dimorphic. Yeast, that is they produce budding yeast cell, example is Cryptococcus. Yeast-like, budding yeast cells will be produced along with pseudohypha will be there. This is Candida. Yeast like is yeast plus pseudohypha. Mold will be true hypha. Example Zygomycetes, Aspergillus and Penicillium. Dimorphic fungus are the type of fungi who will exist as yeast at 37 and mold at 25. They exist as yeast at 37 and mold at 25. Various examples are all the systemic fungus like Histoplasma, Blastomyces, Coccidioides and Paracoccidioides. Apart from that, Sporothrix, Shankai and Penicillium marnefi. Penicillium marnefi. See, Penicillium as such is what? Mold. But Penicillium marnefi is an example of dimorphic. So total 6 example of dimorphic fungus. And many books they have wrongly write as Candida albicans as the dimorphic. Please remember, Candida albicans is not dimorphic. All Candida including Candida albicans are yeast like fungus. They are not dimorphic. Second classification is according to the sexual spore. Sexual classification. They produce three variety of sexual spore: zygospore, ascospore and basidiospore. Accordingly, the families are Zygomycetes, Ascomycetes, Basidiomycetes, and the fungi where the sexual spore is not identified yet, that group is called as fungi imperfecti. Fungi imperfect. Zygomycetes example. Example of Zygomycetes is, they say that Rhizopus, Mucor, Apsidia, etc. Ascomycetes, Aspergillus. Ascomycetes, the examples are Aspergillus. Basidiomycetes, the example is Cryptococcus. And fungi imperfecti is the largest group which covers most of the fungus, because most of the fungus the sexual spore is not identified. Like for example Candida, all the systemic fungus like Histoplasma, Blastomyces, Coccidioides, Paracoccidioides, Dermatophyte, most of the fungus the sexual spore is not classified and they are classified under fungi imperfecti. Okay, so this is sexual classification. The third classification is based upon the disease they produce, that is systemic classification. under which fungi can be classified as superficial mycosis, subcutaneous mycosis, systemic and opportunistic mycosis. Superficial mycosis, you have dermatophyte, Tinea versicolor, Tinea nigra and Piedra. Subcutaneous mycosis, you have mycetoma, then Sporothrix and Rhinosporidiosis. Systemic mycosis, all four dimorphic fungus, Histoplasma, Blastomyces, Coccidioides and Paracoccidioides. Opportunistic mycosis, Candida and Crypto. Other than that, Aspergillus, Zygomycetes, Penicillium, Pneumocystis, all these are example of systemic mycosis. Fine. So let us discuss opportunistic mycosis. Sorry, all these are example of opportunistic mycosis. So let us discuss one by one. We will start with superficial mycosis. Superficial mycosis, Tinea versicolor. Tinea versicolor is a chronic, recurrent, non-inflammatory, non-pruritic, hypopigmented lesion. Most common site is anterior surface like chest and anterior part, flexor surface of the body. Okay, agent is Malassezia, furfur. Malassezia furfur exists as both yeast and mold form, and the yeast form in between the mold hypha are there. Yeast form and mold form both exist together, and this give rise to appearance of spaghetti and meatball appearance. Spaghetti and meatball appearance. Apart from that, it is a urease positive fungus. It is a urease positive fungus. On SDA, that is Severodextrose agar, it produces typically fried egg colonies. Of course, don't forget it is a lipophilic fungus also. And on wood lamp examination, typical golden yellow color is produced. Golden yellow color is produced. Apart from that, apart from Tinea versicolor, Malassezia furfur can cause other manifestation like seborrheic dermatitis. Seborrheic dermatitis, it is nothing but dandruff. In the local language, it is called as dandruff, which we all have in day-to-day practice. Apart from that, atopic dermatitis, folliculitis, all these are the other manifestation produced by Malassezia furfur. Okay. Then Tinea nigra. Tinea nigra is caused by Hortea wernicki. The agent is Hortea wernicki. Nigra is what? Black. Is a black discoloration of palm and sole caused by Hortia wernicke. In contrast, Piedra is the involvement of hair shaft. The hair shaft, it has formation of a nodule over the hair shaft. And the nodule, it could be black in color and white in color. Accordingly, Piedra is called as black Piedra and white Piedra. Black Piedra is caused by Piedra itself, Piedra hortia. Whereas white Piedra is caused by Trichosporum bigeli. It is a urease positive fungus. Apart from that, one more feature is Trichosporum bigeli, you will have arthrospores. Arthrospores will be produced. Then dermatophyte. Dermatophyte, the three important members: trichophyton, microsporum and epidermophyton. The most important difference is the site where they infect. Tri for 3, that is, they infect skin, hair and nail. The microsporum will infect skin and hair but not nail. Epidermophyton infects skin and nail but not hair. Very frequently asked MCQ. If you do a LPCB mount of SDA colony, then they say that two kind of spores are seen. Bigger spores are called as macroconidia and the smaller spores are called as microconidia. Macroconidia and microconidia. Macroconidia, example, Trichosporum will have pencil shaped macroconidia. Pencil shaped macroconidia. Microsporum will have spindle shaped. Spindle shaped macroconidia. Whereas epidermophyton will have club shaped macroconidia. Club shaped macroconidia. Microconidia, Trichosporum plenty and round shape, round or teardrop shaped. Whereas microsporum rare microconidia, epidermophyton microconidia are absent. Similarly, macroconidia in trichophyton will be rare, whereas microsporum and epidermophyton plenty of macroconidia will be there. Okay. So this is the point of difference between all dermatophytes, what you have to remember. Otherwise, they are annular lesion, annular, scaly lesion, and depending upon the infected site, various names are given. Like like Tinea capitis. Tinea capitis is the involvement of scalp. Tinea capitis has got various subdivisions, like various variety. They say that if the hair shaft spores are produced inside or spores are produced outside the hair shaft. Accordingly, it is called as ectothrix and endothrix. Both these are variety of Tinea capitis. Then boggy lesions can be produced, which are called as keroin. Keroin is inflammatory boggy lesions. Whereas fabus is a type of, say that, cup-like crust formation on scalp. This is called as fabus. So all these four are different varieties of Tinea capitis. Then other Tinea corporis, involvement of body, Tinea pedis, leg. So depending upon the part of the body involved, various names are given. Tinea barbi, involvement of the beard area. Tinea facie, involvement of non-beard area of face. Tinea inguinum, nail. Okay, so like that various names are given. Other laboratory diagnosis features, they say that hair perforation test. Hair perforation test is positive for trichophyte and mentagrophyte and microsporum canis. Similarly, urea is positive, again trichophyte and mentagrophyte. Wood lamp examination can be done. Wood lamp examination is done mainly for microsporum species. And one species of trichophyton, that is Trichophyton schwelleni, which is the agent of fabus. Trichophyton schwelleni is the agent of fabus. So most of the microsporum species and one species of Trichophyton are wound lamp positive. They will fluoresce under wound lamp examination. Okay. Then coming to treatment of dermatophyte, they say that the drug of choice will be oral terbinafine or itraconazole. They are the drug of choice. Griseofulvin also is given. Alternate. Okay, so this is all about dermatophyte. Next is subcutaneous mycosis. To start with mycetoma. Mycetoma, clinically, it is a triad of subcutaneous swelling, discharging sinuses, and the discharge contains granules. This is a triad of mycetoma, and they have a fourth property of bony destruction. Most of the mycetoma cases, they have a tendency of bony destruction. Coming to the agent, mycetoma can be fungal, that is eumycetoma, can be bacterial, that is actinomycetoma. Actinomycetoma mainly Actinomadura, nocardia, and streptomyces. Eumycetoma can be most of the actinomycetoma, they produce white granule, white granule, whereas Eumycetoma the granules may be white or they may produce black granule. Produce black granule or white granule. Black granule mycetoma, the agents are Madurella mycetomatis. Apart from that, Exophiala, Curvularia, all these are black granule mycetoma. White granule mycetoma are Pseudolesseria boydii. Then Acrimonium, Fusarium, and Aspergillus, one species called as Nidulans, white granule mycetoma. Clinically, they say that Eumycetoma, actinomycetoma, in general they say that the bacterial agents are more virulent than the fungal agents. So in actinomycetoma, more number of sinuses, more number of swelling, purulent discharge, all this will be there. Whereas Eumycetoma, only one nodule will be there, one swelling will be there, only few sinuses will be there, and the bony lesions are osteolytic in actinomycetoma, whereas osteosclerotic in Eumycetoma. Okay, so this is how they differ from each other. These are the differences in their clinical appearances. Okay, so this is all about. Now we can discuss the other aspects like sporothrix. Sporothrix can cause sporotrichosis, which is also called as Rose Gardner disease. Rose Gardner disease. Okay, so it is a chronic granulomatous nodulo-ulcerative lesion. The lesions are nodulo-ulcerative with the tendency of lymphatic spread. With the tendency of lymphatic spread. And of course, the most common area will be, geographical distribution will be sub-Himalaya. Don't forget it is a dimorphic fungus, that is yeast at 25, mold at 37. The yeast form is described as cigar shaped asteroid body. Whereas the mold form is described as hypha with flower like sporulus. Hypha with flower like sporulus. Okay, so this is all about sporothrix. Then rhinosporidiosis. Rhinosporidiosis Rhinosporidium siberi is the agent. The most frequently asked MCQ is whether it is a fungus or not. They say that it is more close to a hydrophilic protist. If it is not there in the option, then of course fungus will be a better answer. Okay, and of course the most common manifestation will be the nasal polyp, which will bleed on removal. Okay, and stagnant water, taking bath in stagnant water. In India it is common in Kerala, Odisha, etc. Unhygienic ponds, especially ponds and other areas. Regarding the diagnosis, is non-cultivable. Non-cultivable fungus, if they ask, the answer is rhinosporidiosis, the pneumocystis and lockagia. These are the three non-cultivable fungus: rhinosporidiosis, pneumocystis and lockagia. And they say that there is a special stain called as mucicarmine stain. So mucicarmine stain is used to demonstrate the fungus, and it is demonstrated as spherules. If you do a biopsy and stain, when you take a nasal biopsy, the polyp biopsy, and stain with mucicarmine stain, the structures which are demonstrated are called as spherules. Spherule is nothing but it is a big sporangium like structure with numerous endospores. Spores will be there inside. Endospores will be there inside. Big sporangium like structure with numerous endospores. Okay, so this is about rhinosporidosis, and the treatment, they say that surgical removal followed by cauterization. Surgical removal followed by cauterization. And dapsone is given as a drug of choice. It has got some anti-rhinosporidial action, dapsone. Okay, so these are the features of rhinosporidiosis. Now we will discuss about systemic fungus. Systemic fungus like histoplasma, blastomyces, coccidiosis, paracoccidiosis. Histoplasma capsulatum. How to demonstrate the capsule? Which stain? It is not capsulated. It's a misnomer. Non-capsulated. It produces histoplasmosis, which is also called as Darling's disease. Darling's disease, characterized by an acute histoplasmosis and chronic disease. They say that pulmonary manifestation is the most common manifestation. Both acute and chronic pulmonary histoplasmosis is the most common manifestation, and the most common different diagnosis will be tuberculosis. So the mucocutaneous Oral lesions are common in Indian cases. Coming to diagnosis, it's a dimorphic fungus. You know that all the 4 systemic fungus, Histoplasma, Blastomyces, Coccidioides, Paracoccidioides, all these 4 are dimorphic. So dimorphic means they have a yeast form and a mold form. The yeast form of Histoplasma is described as 4 to 6 micron yeast cell with narrow based budding. Even less than that, 2 to 4 micron yeast cell with narrow base budding, very small yeast cells. Mold form is described as tuberculate macroconidia. A tuberculate macroconidia. So these are the features of histoplasmosis, which has to be differentiated from that of blastomyces. Blastomyces dermatitidis. Here the histoplasma, the description of yeast form is 2 to 4 micron yeast cell with narrow base budding. Here it is the yeast form is described as 8 to 14 micron yeast cell with broad base budding. 8 to 14 micron yeast cell with broad base budding, which is described as figure of 8 appearance. Figure of 8 appearance. Blastomycosis is also called as Chicago's disease or Gilchrist disease. And please remember, it is also the otherwise it is called as North American blastomycosis. North American blastomycosis. Of course, the most common clinical form will be pulmonary form. Coccidioides immitis. Here 2 forms are seen. Yeast form is described as spherule. Yeast form is described as spherule, filled with numerous endospores. Spherules, where we have discussed earlier, even Rhinosporidiasis also will have spherule. This is one form. The other form is fragmented hypha. Fragmented barrel shaped hypha described as arthrospores. Described as arthrospores. Barrel shaped hypha which are described as arthrospores. 2 forms. And Coccidioides immitis, it is usually also called as valley fever. The disease is called as valley fever or desert rheumatism. Desert rheumatism. These are the other name of Coccidioides immitis. Fine. Then Paracoccidioides. Paracoccidioides braziliensis. This is endemic in Brazil. So it is misnomerly called as South American blastomycosis. It's wrongly called as, so it is, of course it is found in South American country like Brazil, but it is wrongly called as South American blastomycosis. Here also the pulmonary form is the most common form, and here the yeast form is arranged in 2 appearances. Say that the mother yeast cell and daughter yeast cells, they are vary in their size. Daughter yeast cells are very small, giving rise to Mickey Mouse appearance and pilot bill appearance. Mickey Mouse appearance and pilot bill appearance. Okay, so this is all about the systemic mycosis. Then opportunistic mycosis. To start with Candida. Candida is yeast or yeast-like? Yeast-like means what? It have a yeast form with pseudohypha. Pseudohypha is a sign of invasion. Pseudohypha is a virulence factor sign of invasion. In SDA, it produces creamy white colony. Creamy white dry colony on SDA. The most pathogenic species is Candida albicans. Candida albicans can be differentiated from other Candida species by various tests called as jam tube test. Jam tube test also called as Reynolds Brown phenomenon. Jam tube test. Then other tests like chlamydophore formation on a special medium called as corn meal agar. Chlamydophore formation on a special medium called as corn meal agar. Okay. Other than that, there are specific methods like sugar assimilation test, okay, and chrome agar. All these are other methods by which you can identify Candida albicans. Okay, and please remember the germ tube test and chlamydospore formation. These two can also be positive by one more Candida species called as Candida dubliniensis. So this is a differential diagnosis which you have to keep in your mind. Candida dubliniensis. Okay. Can you tell me what is the difference between hypha and a pseudohypha? True hypha and a pseudohypha. What is the difference? They say that pseudohypha, suppose they say that the septa are constricted and origin of the branch also will be constricted and septate. For example, it is a yeast cell from which a pseudohypha is formed. Though the pseudohypha, the septa will be there, they are constricted and the origin also will be constricted. Whereas true hypha, they will be parallel to each other. They will be parallel to each other. So that is how you should differentiate between pseudohypha and true hypha. Okay, then Cryptococcus. Cryptococcus neoformans. It is an agent of European blastomycosis. European blastomycosis. And here how to remember is, it is a capsulated fungus. Okay, and the capsule can be detected by India ink test. India ink test in CSF is done to detect the capsule, which has a sensitivity of 60 to 70%. Apart from that, capsular antigens you can detect in CSF. That has a sensitivity of 95%. This is done by latex agglutination test. Latex agglutination test. In SDA, of course, creamy white colony like Candida, but because it is capsulated, it produces mucoid creamy white colony. Apart from SDA, there are special media for Cryptococcus such as Niger seed agar. where it produces nigate seed agar, it produces characteristic brown black colony. And this brown black colony is due to melanin production, and this melanin production is due to a enzyme produced by Cryptococcus called as phenyl oxidase enzyme. Phenyl oxidase enzyme. Okay, so this is all about. And regarding the risk factor, of course, HIV infected individual less than 100 CD4 count, eucalyptus tree, and pigeons dropping, pigeons drooping, all these are considered as source of infection. Eucalyptus tree and pigeons dropping. Okay. So this is all about Cryptococcus. Now a bit about Aspergillus and Zygomycetes. Zygomycetes, how it is different than Aspergillus. Zygomycetes, the nature of hypha is broad, aseptate, wide angle, okay, hyaline hypha. So this is the most important difference. Whereas Aspergillus will have a narrow septate hypha, and Zygomycetes three type: Rhizopus, Apsidia, and Mucor. So these can be differentiated from each other by the presence or absence of a structure called as rhizoid. Please have a look. This is the hypha of Zygomycetes. From the hypha, a structure arises called as sporangiophore. This is called as sporangiophore. Sporangiophore leads to a sac-like structure called as sporangium. Sporangium is filled with spores. So just opposite to the origin of sporangiophore, in the hypha there is a root-like outgrowth which is present in Rhizopus, and this root-like outgrowth is called as rhizoid. Whereas in Mucor, only the sporangiophore will be there, the rhizoid will be absent. In Apsidia, they say that rhizoid will be internodal. Rhizoid will be internodal. In between the two rhizoid, the sporangiophore will be there. So Rhizopus will have a nodal rhizoid. Apsidia will have internodal rhizoid. Apsidia will have internodal rhizoid. And they say that on SDA they produce cottony woolly colony. And Rhizopus, later on first the colony will be white, later on the black spots will appear, and that give rise to salt and pepper appearance. Cottony woolly colony with salt and pepper appearance. Salt and pepper appearance. Okay, so this is all about SDA appearance. And regarding the clinical manifestation, they say that rhinocerebral zygomycosis. especially in the form of orbital cellulitis. This is the most common form. The most common form of zygomycosis. There are certain risk factors. Among the risk factors, the most important risk factor is diabetes ketoacidosis. Patient on iron overload. So these are the specific risk factor for, and also patient on dialysis. These are the risk factor for zygomycosis. Among this, the diabetic ketoacidosis is the most important risk factor. Aspergillus, the hypha is just the opposite of zygomycetes, narrow septate hypha, okay, with acute angle branching, okay, and Aspergillus can cause mainly pulmonary manifestation like aspergilloma, of course bronchial asthma, invasive aspergillosis. All these are various pulmonary manifestation. Non-pulmonary manifestation, don't forget Aspergillus is the most common cause of oculomycosis, otomycosis, paranasal sinus mycosis, and Aspergillus flavus can produce aflatoxin, which can cause CA liver,